present in Iraq. It's one of the most important infectious diseases that is endemic in certain parts of the world, as it appears here in this map. So it's present in South Asia, in Africa, and in South America also. So, what is malaria? Malaria is a systemic protozoal infection, which in humans is caused by one of 4 types of the protozoan. We have the Plasmodium falciparum, which is the most serious one. Also, we have the Plasmodium Vivax, Plasmodium Malarial, and Plasmodium ovari. Transmission of malaria occurs by either the bite of the female Anopheline mosquitoes, and the disease occurs throughout the tropics and the subtropics. This is in fact the most common way of the transmission. Also, transmission of the infection can occur via blood transfusion. When there is transfusion of blood from an infected person to a non-infected one, it may lead to the development of the infection and the disease. And also there might be a vertical transmission, which is from mother to the fetus. So the most important way, as we said, is through the mosquitoes, the Anopheline mosquitoes. And that's why later on in the prevention, we can see that one of the most important measures to prevent the disease is by the eradication of the mosquitoes. We should know first about some facts about the life cycle of the malarial parasite. Definitely you have taken this topic in the parasitology, but we will take it in a summary. So, to start with, the female Anopheline mosquito becomes infected when it feeds on human blood containing the gametocytes. So that is a person who is already infected and has the protozoan inside his body. When the female mosquito feeds and bites that person and feeds on his blood, then the mosquito will become infected. Then these gametocytes undergo development in the mosquito, which takes about 1 to 3 weeks, 7 to 20 days, and 1 to 3 weeks. This results in the sporozoites, which is the next stage. And these sporozoites, they usually accumulate in the salivary gland of the mosquito, which then, when this mosquito bites another person or another human, will lead to the transmission of these sporozoites into the bloodstream of human. Rapidly, these sporozoites enter the liver, and after some days, merozoites, they develop into merozoites, which then these merozoites leave the liver and invade the RBCs, where further asexual cycles of multiplication take place, producing the schizons. So, later on, rupture of these schizons releases more merozoites into the blood and causes fever. And this is an important point, the periodicity of which depends on the species of the parasite. يعني مختصر أنه infected person who has the gametocytes in his blood. The female mosquito, the Anopheline, feeds on his blood. These gametocytes enter the mosquito and undergoes development in the mosquito for 1 to 3 weeks to form the sporozoites, which are then inoculated into another person. These sporozoites enter the liver rapidly, and after some days they form the merozoites, which invade the RBCs, and after further multiplication, they produce the schizons. And then there is a periodic rupture of these schizons with release of more merozoites into the blood, which causes fever. Here, there is a difference between the species of the malaria that we mentioned before, the 4 species. It is the frequency and at which time there is the release of the merozoites into the blood with the subsequent development of fever. So this defines the periodicity of each species. Regarding the Plasmodium vivax and Plasmodium ovale, they may persist in the liver cells as a dormant form. dormant نقصد بها شيء يعني انه يبقى لفترة طويلة. مصطلح dormant يعني الشيء يقول مثل نائم. حتى الستيج تسمى hypnozoites. عندنا merozoites عندنا the hypnozoites. أي شيء hypno is related to sleep. So hypnozoites, which are capable of developing into merozoites months or years later. هاي النقطة مهمة. تميز لي البلازموديوم فايفاكس and Plasmodium ovale. عضوهم اثنين بيهم V, ovale vivax. they persist in the liver. همين بينو V. فممكن انه هذول التو species they remain dormant in the liver. يبقى شلون يعني مثل نائم. زين. later on they may be the activation, okay, and release of the active forms which lead to the symptoms again, or maybe even the first time. يعني ممكن انه person he has traveled to an area and he got the infection. He got the infection. أقصد أنه let's say مثلا the bite of the mosquito, and he is inoculated with either Vivax or ovale, and he has nothing, no any symptoms. Maybe months or years after he returns from his travel, he may develop the symptoms. ولهذا حتى ممكن أنه إذا كان عندنا clinical suspicion, we ask the patient about travel history. مو بس نسأله على travel history أنه recent travel history مثلا خلال نقول له آخر أسبوعين 3 أو شهر. أي travel history even in the far past ممكن أنه يكون يفيدنا. ليش؟ لأنه قلنا هوني they have the dormant stage, the hypnozoites. On the other hand, Plasmodium falciparum and Plasmodium malariae have no persistent exoerythrocytic phase. يعني يختلفون عن الفيفاكس and the ovale. They are just in the erythrocyte, in the RBCs. بس احنا اللي صاعدنا انه البروتوزون يدخل جسم الانسان الى البلد عن طريق البايت. Rapidly they go to the liver and then they are released again into the blood where they invade the erythrocytes and cause the disease. ممكن أنه عندنا 2 species they can remain dormant in the liver. وعندنا the other two species اللي هما Malaria and Falciparum, they have no persistent phase. Regarding the pathology, red blood cells, which are infected with the malaria, they are prone to hemolysis. Hemolysis, it is the breakdown of the RBCs, and which can result in anemia. تعرفون أنه بالنسبة للcauses of anemia, one of the causes is underproduction of the RBCs, إنتاج RBCs قليل, or there is increased destruction of the RBCs. فهوني احنا اللي يصير عندنا هي RBCs produced لكن they are infected with a protozoan, so they are prone to hemolysis breakdown. This can lead to anemia. ولهذا ممكن they present with fever and stages of anemia. This anemia is most severe with the Plasmodium falciparum. احنا قلنا بالبداية أنه falciparum is the most serious one. Because Plasmodium falciparum invades red cells of all ages, especially the young cells. يعني خلينا نقول بالنسبة للفالسيبارم species invade all the stages of the RBCs, from the young, from the precursor to the mature RBCs. بينما other types, okay, Plasmodium Vivax and Ovale, Vivax and Ovale يعني they are the same, almost the same. Vivax and Ovale, they invade the reticulocyte, اللي هي الريتيكولوسايت أكيد تذكروها بالفسيولوجي من صف ثاني، هي the stage just before the mature RBC. Plasmodium malariae invade the normoblasts, which is an earlier RBC precursor. بس احنا اللي نريد انه يكون عندكم واضحة انه the falciparum invade red cells of all ages, from the young precursors to the mature RBC. ولهذا hemolysis occur in a more severe way. In Plasmodium falciparum malaria, red cells containing the schizons adhere to the capillary endothelium. يعني هوني أنا ما بس عندي بالنسبة للفالسيبارم malaria ليش إنه it is more severe than other types. أولاً because it invade all stages of the RBCs. Next, the red cells which contain the schizons adhere to the capillary endothelium in vital organs, in the brain, the kidney, in the liver, in the lungs, the gut, which result in vascular congestion and organ damage. تعمل لي occlusion of the small vessels. بالنتيجة راح يصير عندي reduced perfusion to the vital organs اللي ذكرناها هاي كلها. Clinical picture. Regarding the clinical picture of Plasmodium vivax and Plasmodium ovale. احنا قلنا دائما يعني يتشابهون. Plasmodium vivax and Plasmodium ovale infection, in many cases, the illness starts with several days of continued fever before the development of the classical bouts of fever on alternate days. هاي ليش خليناها in bold script. Fever on alternate days يعني يجي البيشنت يقول لكم انه صار لي فترة تجيني الحرارة يوم ايه يوم لا. هاي اشني this is the periodicity of the infection regarding these species. يعني اللي ذكرناها قبل شوية نرجع على السلايد اللي هي rupture of schizons, release more megazoites into the bloodstream and cause fever. The periodicity. فهي the periodicity regarding Vivax and ovale. Fever occur on alternate days. ممكن يوم عندي حرارة ويوم لا. Fever starts with rigor. قلت أرجف من الحرارة. The patient feels cold and the temperature rises to about 40 degrees. High fever. After half an hour to 1 hour, then the hot or the flush phase begins. يجي يقول لكم انه اشعر انه بردان كلش وارجف، حتى ممكن حتى يعني يقلكم حتى طق اسناني، وهذا الرايجر there is chattering of teeth. يقلكم فد نص ساعة ساعة بعدين بالعكس أشعر إنه هو كلش عميان. ف feel cold with high fever and then there is the hot flush. It lasts several hours and gives way to profuse perspiration and a gradual fall in temperature. أول شيء يقلكم بردان وأرجف ولا أتغطى بطانيات، بعدين يقلكم بعد ساعة تقريبا بالعكس أشعر كلش حارة وظل حميان، إلا يقلكم أعرق قصير ما يصير فيها ذاك الوقت تبدي شوية تنزل الحرارة عندي. هذا بالضبط اللي تسمعونه من ال patients. So there is rigor يعني chills, and then there is the hot flush. It lasts for several hours, and then profuse sweating with fall of the temperature. The cycle is repeated 48 hours later. Gradually يعني هو يعني خلينا نقول اليوم صار عنده الاتاك، زين، غدا ماكو عنده إلى بعد غدا، فلهذا إنه هي for 48 hours. Gradually the spleen and liver enlarge and may become tender. ممكن they complain from abdominal pain. Anemia develops slowly here. ليش؟ لأنه قلنا بالنسبة لل Vivax and ovary they invade certain stages of the RBCs. The first attack of clinical malaria may occur long after the patient has left the endemic area, and the disease may relapse after treatment with drugs that kill only the erythrocytic stage of the parasite. هاي النقطة اللي حكيناها قبل شوية. ليش هوني بالنسبة للفايفاكس and ovary أنه the first infection may occur يعني a long time after leaving the endemic area، قلنا بسبب وجود the hypnozoites which are dormant in the liver. هاي نقطة. ممكن أنه هذا البيشنت لا هو صار عنده الانفكشن من البداية with Vivax or with ovary، لكن he received treatment just يعني that can eradicate or kill the erythrocytic stage of the parasite. فلهذا هو تمام تعالج من الفيفاكس أو الأوفاري اللي هي in the RBCs، لكن he still has the hypnozoites in the liver، فممكن هذا يخليها يعني مخزون من الباراسايت بحيث انه بعدين راح ترجع له السيمبتومز والانفكشن نفسه. فإما يتأخر الفيرست انفكشن أو ممكن يجيني relapse كله بسبب وجود the hypnozoites in the liver. Regarding the Plasmodium malaria infection, this is usually associated with mild symptoms and bouts of fever every third day. هوني بالعكس قلكم كل 3 أيام تجيني الحرارة. وهون يعني البيشنت سواء كان بالفيفاكس أو أوفالي أو ملاريا، خاصة لما يكون كان صار له فترة المشكلة عنده، يطيق أنه يحفظ يصل إلى هالاستنتاج أنه مثلا يقول لكم أنه تجيني الحرارة كل يومين بالثالث، يوم أي يوم لا، فهي هاي the periodicity. In Plasmodium malaria, it is every third day. Parasitemia may persist for many years with the occasional recrudescence of fever. Recrudescence نقصد بها أنه the recurrence after an improvement. With occasional recrudescence of fever or without producing any symptoms. فإما يعني يصير عندي the parasitemia either with fever or without fever. Plasmodium malaria causes glomerulonephritis and nephrotic syndrome in children. This is an important point. So generally it is a milder form, and the periodicity is fever every third day. Now we come to the clinical picture of falciparum malaria. This is the most dangerous form of the malarias. The onset is often insidious, with malaise, headache, vomiting, and is often mistaken for influenza. Also, cough and mild diarrhea might occur. That's common. The fever has no particular pattern. يعني هون نقول تقريبا there is no defined periodicity. ماكو بيفد نسب معين تجي. ما مثل الملاريا قلنا every third day or Vivax and overly on alternate day. So the fever has no particular pattern. Jaundice is common due to hemolysis and hepatic dysfunction. إذا هون شوية نقف عند هاي النقطة. أنا الجوندس يعني شلون يصير عندي؟ هو تعريف إنه هو hyperbilirubinemia. وتعرفون the bilirubin we have the indirect or the unconjugated bilirubin اللي هو mainly present in the RBCs. وعندي the conjugated or the direct bilirubin اللي هو يعني the unconjugated or the indirect bilirubin undergoes the conjugation in the liver. فأنا هون بالنسبة للفالسيبارم malaria أولا أنا مسبقا أعرف أنه the parasite invade all stages of the RBCs which makes them prone to hemolysis. فلما يصير عندي هالهيموليسيس بهالعدد الهائل من RBC راح يصير عندي release of the unconjugated bilirubin. نفس الوقت ذكرنا قبل شوية أنه واحدة من الأشياء اللي تجعل الفالسيبارم malaria more severe أنه there is adherence of the infected RBCs to the capillary endothelium in the vital organs. One of them is the liver. This will lead to shortage in the perfusion and organ damage. It will also lead to hepatic damage, liver damage will lead to also to jaundice. jaundice عندي يحصل من طريقين, من hemolysis of RBCs and from hepatic dysfunction. هاي نقطة مهمة. The liver and spleen enlarge and become tender. Anemia develops rapidly, as does thrombocytopenia. Thrombocytopenia اللي هي low platelet count. لأنه البليتلت ممكن مرات هي تسمى كذلك thrombocytes. thrombocytopenia معناته أنه low platelet count. فشفتم هون أنه anemia develops rapidly. Again, because it invades all stages of the RBCs. فهون صار عندي بالنسبة للفالسيبارم malaria. It has an insidious onset with non-specific symptoms: malaise, headache, vomiting, diarrhea, cough. اوكي تشبه الانفلونزا، لكن ايضا هون راح يميز لي انه rapid anemia with jaundice and tender organs اللي هي liver and spleen. والنقطة المهمة also يعني the fever has no particular pattern, يعني no periodicity. A patient with falciparum malaria apparently not so ill. Okay? Sometimes they may not appear so ill, okay? But may develop dangerous complications. اللي قلنا ليش تحصل complications ذكرنا بسبب adherence to the capillary endothelium in vital organs. and also because of the rapid hemolysis and rapid anemia. Cerebral malaria is manifested by either confusion يعني تشوش بالوعي, convulsion اللي هي الشمرة أو يعني ما الصلع بس هي خلينا نقول الاختلاج, or coma. Children might also be infected and they die rapidly without any special symptoms other than fever. Immunity is impaired in pregnancy, and abortion from parasitization of the maternal side of the placenta is frequent. So it is dangerous also for children and for pregnant ladies. Splenectomy increases the risk of severe malaria. So falciparum malaria is the most serious and the most severe form. So here are some of the complications that might occur in case of falciparum malaria. Coma might occur due to the cerebral malaria. Hyperpyrexia, which is a high fever more than 40. Convulsions, again, it can occur either because of the high fever or because of the cerebral malaria. Hypoglycemia, this is also common. It occurs either by the infection itself or by certain types of medications used for the treatment. Severe anemia, packed cell volume less than 15. Sometimes it's less than 15. واحنا الهيموغلوبين حتى اذا خلينا نقول في طريقه سريعه تحسبون الهيموغلوبين عن طريق الباكت سيل فوليوم, اما يسمى باكت سيل فوليوم او يسمى ذا هيماتوكريت, فهو نفس الرقم اللي يطلع لنا تقسيمه العدد. فهون اذا 15 نقول يعني معناتها الهيموغلوبين is less than 5. So severe anemia. واحنا نعرف الانيميا انه تكون severe when hemoglobin is at any value less than 7. إما نقول 7 جرام per deciliter أو إذا بالوحدات الجديدة نقول 70 جرام per liter. Acute pulmonary edema regarding the respiratory system. Acute kidney injury. Acute kidney injury اللي هي نقصد بها acute renal failure. يسموها black water fever. ليش سموها black water؟ لما عندي severe intravascular hemolysis راح يصير عندي release of free hemoglobin in the blood which enters the kidney and filtered at the level of the glomerulus to produce a dark colored urine. لكم الإدرار مالي لونه مثل الشاي أو مثل البيبسي, وأنتم أكيد ما قلت عليكم يمكن بالفصل الأول قلناكم هي أنه when you have dark colored urine لكن in microscopy أجي أعمل له فحص بالمجهر there are no RBCs, so it's just a pigment. وإذا تذكرون البيجمنت قلنا إما هي هيموغلوبينيوريا اللي هي جاي من الهيموليسيس أو قلنا قد تكون مايوغلوبينيوريا اللي هي جاي من البريك داون of skeletal muscles. هوني الوضعية عندي أنه there is hemoglobin black water fever. شوفوا أنه different يعني حسب ال degree of the hemolysis نشوف the darkness of urine, يعني هذا يبي dark, هذا more dark, هذا black. A patient يجيكم he is living in an endemic area or he traveled to an endemic area فجعل كم fever مع جوندس مع هل دارك يوغن, نخلي واحدة من الأشياء بعدنا نخليها هي ذي ملاريا. شوفوا هوني جوندس in the eyes واضح, yellowish discoloration واضح. The other complication is spontaneous bleeding and coagulopathy. البليدنج هون أنا يصير عندي قد يكون نتيجة الثرومبوسايتوبينيا اللي هي reduction in the platelet count، وكذلك ممكن أنه from the reduced production of coagulation factors. نحن نعرف إنه coagulation factors many of them are produced in the liver، وممكن هون من الليفر damage اللي عندي هم يقل عندي the clotting factors أو coagulation factors and make the patient more liable to bleed. Metabolic acidosis موت الدم. shock a circulatory shock يسموها algid malaria. It is shock with hypothermia. The patient has a low temperature. هاي العلامة حتى تتذكرون algid معناتها cold. وأكيد كان شفتم هاي النوع من الآيس كريم اللي هي ماركة الجيدة، هي من algid جي حتى تتذكروا. Okay, so it is shock with hypothermia. Aspiration pneumonia is also one of the complications. And last we have hyperparasitemia. That is when more than 10% of circulating RBCs are parasitized in non-immune patient with severe disease. فهذا أيضا يعتبر one of the complications and severe forms. هنشوف later on هذا يحتاج يعني special type of treatment. يعني تقريبا نشوف إنه يعني most of the organ systems are involved. The brain, coma and convulsion, blood, anemia, thrombocytopenia, and coagulation defect lead to also to bleeding, acute pulmonary edema guiding the respiratory system, acute kidney injury, and shock. ممكن انه يكون when in the brain there is reduced consciousness level, there is cerebral edema, jaundice, hepatic impairment, and hemolysis, anemia, pulmonary edema, hepatosplenomegaly. هاي مهمة. One of the differentials of hepatosplenomegaly is malaria, acute renal failure and oliguria, يعني low urine output, oozing from puncture sites due to bleeding diathesis caused by low platelet count and poor clotting factor production. ممكن تشوفون انه عنده مثلا from the side of the can تشوف انه there is oozing of blood or bleeding in the skin or bleeding or internal bleeding. So bleeding is one of the complications. إضافة لما ذكرنا أنه the other generalized complications اللي قد يكون عندنا hypoglycemia, metabolic acidosis, regarding the diagnosis, هنخليها إن شاء الله diagnosis and treatment in the next lecture. هل عنده سؤال بالنسبة للموضوع اليوم؟
عفوا دكتور، بس الثرومبوسايتوبينيا ليش تصير؟
ايش نعاني؟
الثرومبوسايتوبينيا ايش سببها؟
يعني انه ليش طلع لنا البليتلت؟ ممكن انه احنا قلنا انه يعني invasion او affection of many organ systems. ممكن انه one of them is the bone marrow. okay, which is responsible for the production. واحنا نعرف انه shortest half life هي in the platelets, فهي the first to be affected. هذا واحد. اثنين، السبلينوميجالي اللي يصير okay when there is an enlarged spleen, sometimes there is entrapment okay of platelets in it. It is not just an enlarged spleen, it leads to affection of one of this bloodlines, and again the first line to be affected is the platelets. فبهاي الحالة لما يكون عندي سبلينوميجالي with cytopenia، اللي أقصد بيها cytopenia يعني involvement of one or two or three bloodlines، إما RBC YBC platelet، واحد من ثلاثة. often the first is the platelets. فهذا enlarged spleen مع cytopenia يسمى hypersplenism. اوكي، حد عنده بعد سؤال؟ ماكو بعد سؤال يعني؟ شكرا جزيلا.